Sarah delivered her baby 6 months ago. Since then, she only breastfed him because she wants her baby to only have natural things and stay away from manufactured foods. However, recently she started noticing abnormal things in her baby. He always seemed to be tired. His skull bone did not close as the doctor told her it would. Moreover, every time she comes to hold her baby, she finds his clothes wet due to excessive sweating. In the last 3 months alone, she had to take him to the pediatric clinic 3 times due to wheezing. Whenever she looks at her baby's feet, she notices that they are not straight like normal babies, but what scared her the most, recently the baby started doing abnormal movements with his hands and feet. I mentioned only 6 signs, but don't worry, we promised 7 in the title, and the 7th one will be mentioned later. But for now, let's talk statistics. It is estimated that there are around 1 billion people with vitamin D deficiency in the world. If you have a modern lifestyle, meaning an office job and you stay indoor a lot, especially if you live in a place that doesn't get a lot of sun most of the year. In a clinical study done on pregnant Japanese women, the amount of vitamin D in the blood dropped significantly during pregnancy compared to levels after delivery. So what we can see from this graph is that on the left side or the y-axis is the amount of vitamin D in the blood, while on the right side or the x-axis is the time of trimester during pregnancy and even after delivery. We can clearly see that the amount of vitamin D in the blood significantly changes during the time of delivery and before and even after. Note that in this study, women did not have any outside interference with their vitamin D levels, so they did not get any. Vitamin D is normally made from the cholesterol in our body, but for this to happen, we need sunlight, because the UV lights from sun rays helps this action to take place. Adults with light pigmentation can generate around 10,000 to 20,000 units when their whole skin is absorbing sunlight for around 10 to 15 minutes. But let's be honest, who is going to sit outdoors naked for 10 to 15 minutes every day? Especially that there are many other factors that include the amount of vitamin D synthesized, such as the degree of pigmentation of the skin, the body size, the season, and the amount of clouds during that day. So with a lot of these factors, it's difficult to determine the time frame that will give sufficient vitamin D for babies. And let's be honest also, nobody wants to leave his baby naked for 20 minutes in their backyard during a sunny day, especially if he's light-skinned. If you agree, make sure to leave a thumbs up. Babies will love you for it, and who knows, you might save a baby's skin from being burned. But aren't babies getting enough nutrition from breast milk? Well, that's the problem. Breast milk is an excellent nutritional source for babies. The only problem is that it lacks vitamin D and iron. So babies who are excessively fed breast milk and only breast milk for around 6 months, they will now start showing some symptoms of vitamin D deficiency. Mother can increase the amount of vitamin D in their milk by increasing their intake, but the safety of such actions is not researched enough, especially because vitamin D can have toxic manifestations, and she needs to take really high doses for that to be transferred into her milk and then to her baby. Another interesting fact to mention is that recent studies on vitamin D as age boosting, especially when given to pregnant mothers. But to explain this, we need to understand what a telomere is. Telomeres are present at the end of your chromosome. They are colored red on this chromosome. When we get older, they start decreasing in length, and because they get shorter with age, and once they are gone, the DNA gets destroyed and the cell dies. This is one of the main subjects in anti-aging research. Now here's the thing. Telomeres are lengthened by an enzyme called telomerase, and this telomerase enzyme's activity is actually increased when vitamin D increases in your body. There are even research that demonstrated a direct correlation between the length of telomeres in a baby and the amount of vitamin D in the mother's blood during pregnancy. You can see in this graph that when the amount of vitamin D in the mother's blood increases, the length of the telomere in the newborn increases. If you are interested to know more about this study, you can check out the description for the link for the reference. The video title said 7 signs, while we only mentioned 6 and we promised you the 7th. So, Vitamin D plays a huge role in the memory preservation and cognitive skills. Researchers at Tufts University in Boston analyzed vitamin D blood levels in over 1,000 people over the age of 65 to see its relationship to cognitive function. These people performed Warson tests of executive functions such as reasoning, flexibility, and perceptual complexity, attention, and processing speed, compared with those that had optimal levels of vitamin D. These symptoms could even become worse up to reaching mental fogginess, which we covered in another video. So when Sarah heard about all of this, she went to the closest vitamin store and bought the best, most expensive vitamin D supplements that she could find. She wanted a piece of this phantom of youth-like pills that gives you anti-aging, strong bones, and good immunity powers. Then she started taking 3 to 4 pills per day. Few weeks later, she started feeling pain in her bones, stomach, and fatigue. She started going to the bathroom more frequently, but every time she goes for it, she feels pain. This is because vitamin D can also be toxic. The main thing it does is elevating calcium levels in your bone, in your blood, and calcium is what causes all of these problems that Sarah experienced. Well, that's it for today. Thank you for watching, and for people who have reached this point in the video, here's a tip for you. When you take vitamin D, take it after a meal, because it actually needs fat to be absorbed from the stomach. And put some olive oil on your salad, otherwise all fat soluble vitamins won't get absorbed in your intestine. One more thing, don't take it before sleep because it can interfere with the amount of melatonin in the brain, causing alertness, and that's actually going to give you a worse quality of sleep at night. Because melatonin is the substance that makes you feel like you want to sleep. If you enjoyed our video, make sure to subscribe because this is what we always publish. It's health related content from latest medical research.